Ever heard of Kawasaki disease? No? Well, it's high time you did. Kawasaki disease, also known as KD, is a type of vasculitis. Now, vasculitis is a fancy term for inflammation of the blood vessels, and in the case of Kawasaki disease, it's the arteries that bear the brunt. The coronary arteries, the ones responsible for supplying our hearts with blood, are especially affected. Now, when we say Kawasaki disease, we're talking primarily about children. It's most common in youngsters between the ages of 12 months and 5 years. It's like a storm that sweeps in, bringing with it a prolonged fever, skin rash, and changes to the extremities, among other symptoms. But here's the thing, what causes this storm is still a mystery. The exact cause of KD is unknown, but it's believed to involve an infectious trigger and an immune response in genetically susceptible individuals. While Kawasaki disease is serious, knowledge is power. Let's dive deeper. Diagnosing Kawasaki disease is not a straightforward task. Just like solving a puzzle, doctors have to piece together multiple clues to arrive at a diagnosis. The challenge lies in the fact that there is no single diagnostic test for Kawasaki disease. So how do doctors diagnose this illness? Well, they usually start with a thorough physical examination, checking for the classic symptoms such as prolonged fever, rash, and inflamed eyes. Blood tests and urine tests also play a crucial role. They help to rule out other diseases and confirm inflammation, a key feature of Kawasaki disease. But the investigation doesn't stop there. Doctors often use an electrocardiogram, or an EKG, to check the heart's electrical activity. An echocardiogram, which is essentially an ultrasound of the heart, can detect any abnormalities in the coronary arteries. It is indeed a complex process, but a necessary one. Each piece of the puzzle brings doctors closer to confirming the diagnosis and starting the right treatment. Accurate diagnosis is vital, but what are the telltale signs of this disease? Kawasaki disease has a distinct set of symptoms. One of the key indicators of this disease is a prolonged fever that often lasts more than 5 days. The fever is usually high and unresponsive to usual treatment methods. Alongside this, a skin rash may appear, often characterized by redness and peeling on the hands, feet, and in the diaper area. Conjunctival injection, or redness in the whites of the eyes, is another common symptom. This is not associated with pus or the usual discomfort of conjunctivitis. Oral mucosal inflammation is also observed. The lips may be red, cracked and dry. The tongue may appear to be strawberry-like due to inflamed bumps. Changes in the extremities are seen too. The hands and feet may swell and the skin may peel off. Lastly, there may be cervical lymphadenopathy, which is the swelling of lymph nodes in the neck. These symptoms may not all appear at once, and some may not appear at all. This makes Kawasaki disease a diagnostic challenge. Awareness of these symptoms could lead to early detection. Now, who is most at risk? Kawasaki disease has a unique epidemiology. This inflammatory condition typically manifests in children between the tender ages of 12 months and 5 years. Intriguingly, certain regions and ethnic groups appear to experience a higher incidence of the disease. This pattern suggests that geographical and genetic factors may play a role in the disease's occurrence, but the peculiarities of Kawasaki disease don't stop there. The disease presents a fascinating temporal pattern as well. It appears to be more common during the colder months, peaking in winter and early spring. Perhaps most intriguing is the gender susceptibility. Boys seem to be more prone to developing Kawasaki disease than girls, indicating a potential male to female bias. This bias points to possible differences in immune responses between the genders, adding another layer of complexity to our understanding of this disease. With these statistics in mind, what are the survival rates? Survival rates for Kawasaki disease are encouraging. This is a message of hope we carry through the uncertainty that this condition often brings. The case fatality rate is low, which is a beacon of light. However, we must be vigilant as deaths that do occur are usually due to cardiac complications. This underscores the importance of early diagnosis and effective treatment to prevent these complications. Let's recap what we've discussed. Kawasaki disease is a form of vasculitis that primarily affects children, causing inflammation in the walls of arteries. Its diagnosis can be challenging due to the lack of a single diagnostic test. The disease presents with a range of symptoms including prolonged fever, skin rash, and mucosal inflammation. Epidemiologically, it is more common in boys and occurs most frequently during the winter and early spring months. The exact cause of Kawasaki disease remains a mystery. However, it is believed to involve an infectious trigger and immune response in genetically susceptible individuals. While Kawasaki disease can be a scary prospect, armed with knowledge, we can fight it effectively. Stay informed, stay healthy, like, share, and subscribe, and